I'm running for Multnomah County City Commissioner because too often the decision-making at Multnomah County lacks focus, it lacks urgency, and it lacks accountability. For example, we're doing this interview across the street from the site that used to be the sobering center, that used to be the place that police and fire and other outreach workers could take people that were having psychotic responses to drugs, alcohol. It closed 5 years ago. We have been without this service for 5 years, and that costs lives, livelihoods, and it's an example of the lack of focus, the lack of urgency, and the lack of accountability. Now, I offer someone who has taken on difficult issues with success, and that's what I bring to my race, and a passion for making this city better.
I actually remember, I can't believe it's been 5 years, because I remember this being the spot. I remember the cheers.
Yeah.
Everything used to be here. You used to see that in action.
That used to be the parking lot, and you would see the Cheers vehicles in that parking lot.
Were you part of getting that open in the first place?
It's interesting. My history goes back with Portland Mayor Vera Katz to 2009. My history goes back when I worked for Portland Mayor Vera Katz, when the county first defunded the then called the Hooper Detox Center. And so she recognized, Mayor Katz recognized the importance of having back then mostly a place for people who had overused alcohol, a place for them to detoxify. She decided she was going to pay for it if the county wasn't. So, but this is an example. The closure of the sobering center 5 years ago is an example of the county's too often lack of focus, lack of urgency, lack of accountability. When I was back in City Hall for 2 years in the mayor's office, when I was back in City Hall for 2 years, starting in February 2021 in the mayor's office, my team and I, getting the sobering center open was one of our top priority. And time again, we hit the barrier of county government saying this was not a priority. And so when this seat opened up, I wanted to make a contribution to stop this dysfunction at county government, to get all the cities and the counties, to get all the cities and the county and Home Forward and other nonprofit providers on the same page with joint budgeting, joint accountability, joint public reporting. I mean, depending on how you count the amount of money, and remember, taxpayers have voluntarily chosen to increase their own taxes to take care of this issue of homelessness, to take care of the issue of affordable housing and more resources for drug addiction and for mental health issues. They have raised their taxes, and they're not getting enough results. And it's that passion, it's the experience of taking on these tough, gnarly issues over the years that I offer in my candidacy for county commissioner.
I want to ask you one more question about this, and then just to get a little more in depth about it. Would you say that in your time at the mayor's office trying to work on getting this open, was it because it's something that requires the collaboration, that the city couldn't do it on their own, and that the fact that there was no bridge that was, or maybe communication lines or common sense of urgency was the reason why we're sitting across an empty building today?
So we're sitting across this empty former, we're sitting across the street from the former sobering center. 5 years since it closed, with totally inadequate progress on replacing it. Because when my team and I, for the 2 years I was back in City Hall, and this was a priority to get this back opened up, we worked directly with county staff, county officials, and they didn't think it was a priority. I passionately disagree. I think Portlanders and residents of Multnomah County would disagree. And this is an example where the county has oftentimes a lack of focus, a lack of sense of urgency, and a lack of accountability. And I want to change that, and I offer a track record of getting tough stuff done.
And you've been on it, you've been on the city side of things.
Yeah.
This will be a new role, kind of going into the county side of things.
Yeah.
Taking with you what you have, the experience that you have, and knowing pretty well how things work at the city, into this new role in the county, which I imagine would be somewhat similar in the fact that it is public service, but different because it's county and a whole other ball of wax, right? Could you talk about what you feel your challenge might be, or where your successes might be?
Sure.
Taking a role a little different like that?
Well, I chose to run for this county commissioner seat, not one of the new city council seats, not for mayor, not for Congress. I chose to run for this specific position because I feel I have something to offer that humbly is relatively unique. I know city government pretty well. I know it pretty well. I have worked in a leadership position there with 6 county chairs and with dozens of county commissioners. And I have never seen the partnership between cities and county as bad as it is now. I'm very lucky. I have the endorsements of former county commissioners who knew what it was like to work well across these artificial, sort of siloed bureaucracies, and knew as leaders the importance of it working as much as a seamless system as it possibly can. Human wellness is a shared responsibility of cities like Home Forward and the county. It always will be. So the question is only how well is that shared system going to work? And right now, it's not working well. So what I offer is the ability for the county, I hope, to inject in the county this sense, a deeper sense of partnership. And with that, more accountability and more focus. But it's also, I have the opportunity, because of my city and working with the county over the years, I think I offer the ability to get everyone working well together. And not just in a kumbaya way. I'm talking about stepping it up, joint budgeting. Systems have got to work for the people that they're intended to serve. I tell you, having shadowed some folks that were homeless and had other illnesses that wanted to get off the street, it's a nearly indecipherable system. Multiple places that you have to apply to. There isn't an adequate client tracking system to help make sure that people that are facing really tough challenges are helped by the system to go to the next place, that the follow-up for their appointments happens, that if there's transportation issues, they get them. Now, when I was back at the city, my team and I sought to walk our talk. We found that houseless people that wanted to get off the street had to basically, if they didn't stumble across one of the handful of outreach workers, they had to figure out where a shelter was. They had to have a phone. They had to call the shelter, and the staff that is underpaid and overworked have them answer the phone, sometimes across town, see if there is a bed open or multiple beds open because they couldn't reserve one, find a way to get there. What do they do with their stuff? Well, we reformed that. We said, we're going to put the vacancies, the shelter vacancies online. We're going to have it so the outreach workers have it on a pad to know where they're at. We're going to give them the ability to reserve it for a number of hours. We're going to help the folks with their stuff, pack it up. There'll be a place to store it for free, and we're going to give them a ride to the shelter. That is a much more humane way, a much more Portland-like way to treat people that are facing tough challenges. The rest of the system needs to sort of, I think, pick up that kind of goal for everybody else, because it's a lose-lose. If we make it so hard for those people that actually want to take a step away from mental illness, that want to take a step away from addiction recovery, that want to get off the streets. It's way too hard. And that joint budgeting, that joint oversight, that joint accountability, an annual report card of how the system as a whole is working. No longer should people be graded by how their one little program is doing. This is about getting the upwards of $560 million this year spent on houselessness, housing, mental health, and addiction recovery services, spent across dozens of departments and bureaus and multiple cities and multiple agencies. We need to move fast. I'd give them 90 days, come up with a joint budget, which is implementing a set of actions that we think will work. We're going to monitor it as we go, make changes as we go, because we're going to learn a lot, but it's got to be accountable. And it's got to be an invitation that those that on their own have to decide to take a different route in their life, it has to be an invitation. It has to be an offer that they have confidence in. And right now, I totally understand why they wouldn't.